All right, so today we have Sarah in. She's having problems post-op for her ACL. She has 1 out of 10 pain, so we're not treating her for pain today. She's having trouble firing her quads and getting her quads moving after that surgery. So we're using neuromuscular electrical stimulation on her, some biphasic pulse current, because that's going to help with the same physiological improvements as normal exercise training. And it's also beneficial early on in the rehab because it is difficult for her. Also, it's going to help with some neuroadaptations by allowing for enhanced recruitment of motor units. And so some of those things that we look for that when we don't want to do e-stim is loss of sensation over an area, heat sensitivity over an area. There's metal or some type of pacemaker or electrical implant over areas of a female that is pregnant. And so we have to make sure to ask her those today. So I'm just going to switch over to the patient side. So we have Sarah here. Hello, Sarah. My name's Tyler. I'm
Hello.
a student of physical therapy under the direction of Dr. Clausen.
Mm-hmm.
And so it looks like you're coming in today. You're having some problem with your quad muscle, getting it firing. So we're going to be using some electrical stimulation on you to try to help facilitate that muscle action.
Mm-hmm.
And so I was wondering if you've ever had electrical stimulation before.
I haven't.
So the main thing it's going to do is you're going to feel a little tingling at first before we get to the actual setting that we want. And so with that, we just want to see an active contraction. And then during that contraction, I'm going to have you try to fire that muscle as well, just so we can see a bigger contraction out of that muscle, because that's a very important thing for a post-op ACL.
Okay.
And so in order to do that, I'm going to have to place my hands on the affected area. Is that something that's okay with you?
Mm-hmm.
All right. All right, so I'm just going to run through some of the settings here. So obviously the machine's got to be on. We're going to switch it to biphasic here. And then we're going to change the continuous to, we want 10 on, 50 off. I like a little bit longer ramp just because I prefer it to be more comfortable. Time really doesn't matter because we're looking for contractions. We're going to go frequency up to 80 just so we make sure to get a muscle contraction out of it. And then we're also going to go duration or width up to 400 because for this we normally want somewhere between 2 and 800. And so we're just going to place the electrodes on now. So we're trying to look at the quad here. So first off, I'm going to ask Sarah if she has any sensation issues. So I'm just going to say, so Sarah, I'm just going to place my hand on your leg here and check to see if you feel it. So are you feeling this?
Yep.
Here?
Yep.
And then what about out here?
Yep.
All right. So I'm going to place the electrodes on and try to put them a little bit further away because the quad is a larger muscle, and so I want to try to get it as deep as possible. All right. And so now I'm just going to turn up the intensity. We want it to go as high as possible, but it being bearable. Are you having any tingling yet?
Yeah, I just started.
Okay. How's it feeling?
Oh, it's getting stronger. It's fine still.
Okay. You still feeling okay?
Mm-hmm. Getting pretty strong, but it's still fine. Oh, there we go.
Okay. So we see here a slight contraction, and so I'm just gonna. Are you feeling okay there?
Yeah.
Is it bearable, or do you want me to go down? Okay. So I'm just gonna start the program here, and we see that the muscle is still contracting. So what I want you to focus on now is really trying to activate that quad. And we're just going to try to do two reps of it right now while it's going of you pulling your leg. Perfect. And so now it's on the off phase, so it'll be 50 seconds off, and then we'll be 10 seconds back on.
Okay.
I just really wanted to get a feel for that and see how the quad was firing with the E-stim. And
Mhm.
so, do you feel like, it looked like you were getting a bigger contraction out of that muscle. Do you feel like you were getting a bigger contraction?
Yeah.
Okay, so I'm just going to remove these electrodes now. In the future, when we do this, we're going to be doing it, we're not going to just be doing 2 reps, we're going to be doing more.
Okay.
And so with that, you know, we're shooting for about 10 contractions there, and then a little bit of rest, and we'll work up from there. But other than that, do you have any questions for me?
No.
Okay,
I'm good.
then I'm just going to do one last check of your skin just to make sure everything's okay.
Mhm.
You're still feeling that? Do you feel that?
Yeah.
Okay. Thank you for coming in.
Okay, thank you.